But welcome everybody. Thank you for joining us today for this show and tell for the Wellcome Data Prize in Mental Health. I'm Michael Crowder. I'm an analyst at Social Finance, and we've been working with Wellcome to design and deliver the Data Prize. For those who haven't heard of Social Finance before, we're a not-for-profit organisation that helps ambitious organisations and communities deliver pioneering solutions for lasting social change. And in particular, our data and digital work brings together various fields of expertise: data science, product development, user research, co-production, strategy consultancy, and applies that across the health, social, and public sectors. So the way it's going to work, we're going to take a little bit of time at the beginning to introduce the prize for those who aren't familiar with it, and also introduce today's session. And before that, we'll do a little bit of housekeeping. As you'll have noticed, the session is being recorded. And for those who can't make it today, we'll be circulating a link to this round afterwards once it's uploaded. None of our attendees in the audience will be available beyond the recording, just because of the way the webinar function works. But do let me know if you have any questions about how the recording works. We have two boxes at the bottom of the screen. One of them is for questions and answers. We will explain a little bit how that works in just a second. We also have a more general chat function for broader comments. And it will be great if people can pop in there an introduction to themselves, where you're coming from, what organisation you're representing. Please pop that in there and introduce yourself. It'd be lovely to see who we have on the call today. And we'll be monitoring that throughout. I'm also joined today by my colleague, Juliette. I'm going to hand over to her now to give some background information about the Data Prize. So over to you, Juliette.
Thank you, Michael, and hello, everyone. So my name is Juliette Néron, and I'm the project manager at Social Finance, working on the Data Prize. So before we get started with the team's presentation, I'm going to give a brief overview of what the Wellcome Data Prize in Mental Health is, so that we set the scene before we start. So first, in case you're not familiar with that term, so data prizes are open competition or challenges where participants are using data in order to solve a societal problem. And the Wellcome Data Prize in Mental Health, so it's supporting multidisciplinary teams so that they explore existing data in order to research into anxiety and depression in young people, and so that they also generate scalable and tangible output for the mental health research community. And the aim of this data prize is to help the understanding on what are the active ingredients that are making a difference in preventing, treating, and managing anxiety and depression in young people, and understand what works, for whom, in what context, and why. In terms of what the teams are working on during that prize, so as I said, they are exploring existing longitudinal data sets in order to explore the research question and find some new insights. And in addition to this, the teams are also building a digital tool that will enable future research in the field. And that's what they are going to show us in a bit. To tell you a bit more about the structure of the prize, as you can see, the prize is organized into 3 phases. Each of these phases is 6 months long. There are different levels of funding and support on offer for each phase, and only a subset of teams is progressing from one phase to the other one. So we are currently in the second phase of the prize, so we're midway through the prototyping phase. But to give you a bit of background, so the prize started with the discovery phase, which is the first phase of the prize, and that started in autumn 2022. And during this first phase, so we had 11 teams that participated. And the focus really for the teams in this first discovery phase was to explore the data sets and, focusing a bit more on the research question and getting insights. And so now, as I said, we're in the prototyping phase. So we have 5 teams that have been selected to the prototyping phase. And now the focus of this phase is more around the development of a digital tool that the team are working on. At the end of this prototyping phase, 3 teams are going to be awarded and selected to be the 3 winning team and progress to the sustainability phase, which is the last phase of the prize. And during this last phase, teams are going to be receiving additional funding and support in order to sustain and scale their tool. So that's it for background on the prize, and I'll now hand over back to Michael to tell us more about the session today.
Thanks, Juliet. So the show and tell is fairly self-explanatory, as well as being about telling, so providing a narrative of what's being developed, how we've come to these research questions, how the teams have come to their tools. It's also about showing, so providing some examples, illustrations, and demonstrations along the way. We've had 2 sessions. Today is the second. Yesterday we heard from 3 of our teams, and today we'll hear from 2, and it's all about their progress in developing prototype digital tools. This is very much in line with agile methodology. So rather than waiting for a finished tool, a polished product, which is then shown to everybody, the idea is to show ongoing work and prototypes while they're being developed to get early learning and feedback, and therefore help to iterate and continually improve the tools that are being made. So in terms of what to expect today, the teams will be looking to share their progress, to communicate their learning, and possibly also reflect on some challenges they've experienced along the way. They'll be asking for feedback and input from the audience, and they'll be disseminating some of their work to date, albeit in a prototype form. Each team is going to get a 15-minute slot to present their work, and this will be followed by a dedicated Q&A session for 10 minutes. And what we would ask our audience to do is to post questions in the dedicated question and answer box at the bottom of your Zoom throughout the presentations. And please don't be shy, more questions the better. At the end of each presentation, we'll run through the questions there, we'll choose a selection and try to get through as many as possible from the chat to pose to teams. So we'll read them out loud. And we will be monitoring that Q&A box throughout. So put your thoughts down there as they occur to you. In terms of our agenda, we're about to finish our kickoff now, and we'll be moving on to our first presentation, which is entitled Liberating Data, Our Progress on Bringing Stop and Search Insights to Communities, and that'll be led by Dr. Jolyon Miles-Wilson from Black Thrive Global. We'll then move to a break following the question and answer for that session to a team led by Dr. Jeremy Segret at Cardiff University, and this will be entitled Understanding the Role of Secondary School Environments and Policies and Drivers of School Connectedness to Prevent Anxiety and Depression. Following the Q&A of that, we will lead to a quick wrap up where we'll thank everyone for their involvement today, and we'll also send around a quick feedback link to get your thoughts on the session and how future sessions and show and tells like this could be improved or worked. So that's all from us at the beginning, and we'll launch right into our presentation. So I'm going to hand over to Dr. Jolyon Miles-Wilson for the first presentation. Over to you, Jolyon.
Thank you, Michael. Let me just share my screen. Screen 1. Okay, hopefully just to double check everyone can see my sort of big screen. Great. Hi, everybody. Thank you for being here. I hope you're all well. My name is Jolyon, and I'm joined today by 2 of my team members, Graham and Lucas from My Society. I'm the lead on this multi-organisation project that aims to produce tools and insights that will promote research and public attention on the impacts of stop and search. Today, I'll be presenting our progress on what we've termed liberating data, by which I mean the process of repurposing existing statutory data in a way that unlocks insights and perspectives that will be useful for the public. So our overarching aim in this work is to contribute to and support an evidence base on the mental health impacts of police stop and search. This involves several smaller aims, which I've called milestone aims. So the first of these is to facilitate research on stop and search by making it easier and quicker to acquire stop and search data. Second aim is to conduct our own investigations on stop and search and its impact on young Black people's mental health. And the third aim is to produce a data dashboard that acts as a hub of information on stop and search for the public and researchers. So far we've made great progress on these first 2 aims, which I'll tell you a little bit about in a moment. And over the past few months, our focus has really been on this third aim of producing a data dashboard. So our first steps were to make stop and search data more accessible and usable. We did this by creating some software which allows users to easily acquire stop and search data in a format that's ready for analysis. So this software, which we've called Extract SS, which stands for Extract Stop and Search, essentially makes repeated requests to the police application programming interface, or API, asking for stop and search data for different areas and dates. It then compiles the data it receives into a single database organized into meaningful geographic units. The result of this procedure is a database with approximately 1.5 million stop records for England and Wales from the past 36 months. Now, the organization of this dataset means that it's relatively straightforward to combine it with other datasets that are also organized geographically. So for our second milestone aim, we took advantage of this by combining the stop and search data that we've extracted with data from Understanding Society, which is a longitude household panel survey, to explore this relationship between use of stop and search and psychological distress. So our results at this point are still provisional, but the findings suggest that after accounting for differences in other relevant characteristics such as income, deprivation, and crime rates, there's a positive relationship at a regional level between stop rates of the Black population and the extent to which the Black population experiences psychological distress. That is, in regions with higher rates of stop and search of the Black population, psychological distress amongst Black respondents to Understanding Society is higher. And there's no analogous effect for the white population. So this is specifically happening in the Black population. So the finding suggests that there is indeed a relationship between the rate at which Black people are stopped in an area and the psychological distress experienced by Black people in that area. As I say, these results are still provisional, and we have work to do to refine them, for example, by looking at this relationship at a lower level of geography. So in the prototyping phase, as I said, our focus has been on this third milestone aim, which has been developing the data dashboard. So there are a few key interlinked principles to this work stream. First and foremost, we aim to bring insights to the multiple stakeholders expected to use this dashboard. So these stakeholders include the public generally, but more specifically, we anticipate that it will be useful, particularly useful for researchers, justice advocates and policy campaigners, and young Black people, who are some of the most impacted by stop and search policy. Now, I use the term insights rather than just data because our aim is to facilitate a conversation where we're talking about the most important and socially relevant issues. So we don't just want to present statistics, but rather encourage critical engagement in the discussion. So some of the most important issues concern disproportionality, questions of effectiveness, and the balance of costs and benefits of stop and search, especially for young people and children. And we know this because our approach to this dashboard has been informed from the outset by feedback from some of the stakeholders that we anticipate using it. So we've held a few different focus groups and engaged with stakeholders, including researchers, experts involved in holding the police to account, and justice activists, young and not so young. And many of the people with whom we've engaged are also experts by lived experience, which has provided essential perspective in understanding the human costs of stop and search. So we're keen for you to take a look at the dashboard yourselves, and we have links in a moment that you can follow to have a look at it. But first, I think it's useful to go through some of the main design principles and processes that we've followed so far. So if you give me one moment. So this is a screenshot from the dashboard, as you'll see in a moment. In this dashboard, the data are broken down by both local authority and police force area. And the presentation of data in this way means that policy implications can be leveraged and policy actors identified at both local government and police force levels. To aid with this, the area page, which you get to by clicking onto an area from that map, identifies key actors for the area of interest, namely the police force commissioner for the area and the most relevant MP or council leader. And here we also have the added benefit of being able to link this with another of My Society services right to them, which makes it easy for people to write to their local representatives. So these features will help empower users to engage with relevant local policymakers to voice their opinions and concerns on stop and search policy in their area. In terms of the statistics, the dashboard provides data for each area broken down by ethnicity. So these include stop rates as a function of the population for that area, as well as the ratio between these rates, which is also known as disproportionality, sort of the value of disproportionality. There's also the ability to look at different facets of the data. So users can explore what proportion of stops are in an area looking for a specific thing like drugs, how legislation is used in the area, and critically the outcomes of stops. So for example, what proportion of stops ultimately end in finding something chargeable. Finally, and critical to our aim of liberating data, is the facility to download the data for the area. So this means that with a click of a button, the user can download the stop and search data for an area of interest. Now, this is a far cry away from what someone would need to do to get this data directly from the original source. So if this was, if somebody was interested in looking at data for an area that's outside of London, you would need to know how to use the police API to acquire data for a specific area using longitude and latitude pairs to identify that area and then extract the data. And you'd need to do this for every area and month that you're interested in. So this facility to download data from this page will save people a lot of time and effort, and ultimately encourage engagement with stop and search data, we hope. So we're really keen for you to take a look. So I'll stop talking in a moment, but I thought it'd be helpful before you do take a look to highlight one of the largest challenges that we're currently facing, which concerns balancing the presentation of data in such a way that it's both comprehensible and comprehensive. So we think that it's important for users to receive the full picture in a transparent way, and we think this should mean not oversimplifying the picture. So, for example, we believe that it's important to convey uncertainty around the estimates of disproportionality, which is why we include confidence intervals as well as an explanation of what these mean. And this is important because in some areas this estimate is less accurate than in other areas, which means that the actual value for that disproportionality figure can be higher or lower than the actual value itself. However, it's clear from the engagement that we've conducted so far that this information can provide confusion and can be a bit of an information overload. And so a priority for us now is really trying to find that balance between comprehensive information, but keeping it comprehensible. So as I say, we're very keen to get your thoughts on this. So if you are able to take a look at this dashboard, we also have like a little feedback survey as well. We'd really appreciate your thoughts and feedback. So I have some links here. There's QR codes that will work for scanning, but you can also type in these links. I can also try and sort of share these in the chat as well if that's more helpful, which I'll do right now. But essentially it's https://tinyurl.com/stop search dashboard. So that will take you to our prototype dashboard. And then there's also a link there for dashboard feedback. But I think what I'll do now is, well, I'll just say thank you for your attention, and I look forward to sort of hearing your questions and comments. Here's the team again, and here's some links to the various GitHub repos and also my email address if you're interested in getting in contact. Thanks very much again. I'll stop sharing now and share those links in the chat.
Fantastic. Thank you, Julian, for a really interesting presentation and for taking us a little bit through about the design of your dashboard. They're really interested to see. We have one question. I think Aisha's answered in the chat, but I think it's possibly worth just talking about out loud briefly as well. Just from Farhana, which says that ethnicity here is only as black and white. And what about other ethnicities?
Yeah, excellent question. Yeah. So I should also have said as a caveat to this. So what you'll see in this data dashboard is very prototypical, as the sort of this phase would suggest. So at the moment, there are limitations to what data is contained in there and the way that it's presented. We do absolutely have intention to present this data for all ethnicity categories and the overall picture. And also, we're looking at different ways. We're looking at different ways of presenting the sort of the more specific categories. So right now, all that's there is a broad category of black, a broad category of white, and that's a product of aggregating the multiple ethnicity categories into these superordinate categories. We're exploring our options in terms of breaking those down. It gets a bit more complicated statistically because as we disaggregate it, the numbers get smaller, which makes estimates less accurate. So there's a challenge there. But we certainly have that on the horizon of presenting all ethnicity categories and potentially these more detailed ethnicity categories as well.
Fantastic, really interesting, thank you. And we would encourage further questions in the chat. And also, if any of our other panelists have questions across team, please raise your hand. While you're thinking about that, one from me, I suppose, when we're thinking further again about new developments and what to add going forward, where do you sort of see this tool in 5 years' time, both the format, the role of it, and the impact?
Yeah, great question. So we have an ambition that this sort of dashboard will end up being sort of the hub of stop and search information. It's maybe an ambitious thing, but I don't see any reason why it can't be achieved to have this as kind of the place that everybody knows to go for stop and search data. We think that that's a possibility because our interest is in centering this aim of what it's of the human aspect to stop and search. So we're not looking at it from a kind of removed statistical perspective, although we do feature statistics, but our aim is to have a narrative, to have a conversation. So in future, we also could anticipate input into this dashboard and having areas of it that people can actually share experiences or add to it in a more qualitative way to sort of build up this picture and add to this conversation about the policy of stop and search and how it can be whether it's fit for purpose, how it can be improved, how it can be altered to sort of essentially sort of create this conversation rather than a kind of a one-way conveying of statistics. So we see various different areas of growth in this. So yeah, there's lots to do.
I'm sure. Great, thank you. And we have a question from one of our other panelists. So Jeremy, if you'd like to go next.
Hi, thanks for a really interesting presentation, and it was great, I guess, to make some parallels across the sort of the projects in terms of process. And I was really interested in this balance you talked about between comprehensiveness and comprehensibility, because I think we've been looking at something similar. And I think my question was how you, I guess, address that when you have different user groups. So I suppose, I guess what's comprehensive for or comprehensible for a researcher might be different to what's comprehensible for, say, member of the public looking at it for different purposes. So I suppose I was interested in how you address the needs of different users in that way.
Yeah, thanks, Jeremy. Yeah, it is a real challenge because I guess in some ways it is simpler to target one user and sort of design around that. Things that we've considered so far are things like layering up information. So having a kind of having the foundational important information that is broadly that paints this broad picture, but then sort of layering up with options the kind of the more detailed minutiae. So if you're on the dashboard at the moment, or if you look at it at any point, you'll see that at the moment the kinds of things we're thinking about are sort of like drop down things. So Graham and Lucas have made great progress in sort of presenting this information in a way that's not overwhelming to start with, but you can click on it and then you've got like, okay, an explanation of what this means. There's other ways of doing that visually. So having like little eye buttons that sort of just provide pop-up sort of tool tips, I think they used to be called. So really sort of just I guess thinking about ways that you can allow the user to kind of choose the level of information that they're receiving. So that's one way that we're thinking about at the moment. Because we've sort of experimented with sort of different ways of phrasing words, with different ways of presenting, for example, the risk ratio. So one thing that came from our sort of engagement groups was that risk ratios are intuitively understandable when people don't really think about them as risk ratios. So people understand that one outcome is what 2 times more likely means, but when you kind of frame that in a risk ratio language, it becomes a bit more confusing sometimes. So it's about kind of it's also about language as well, basically, I guess is what I'm trying to say. So that's kind of what we've experimented so far, is kind of looking at how to use language in different ways, as well as this visual, sort of changing visually what we're presenting.
We have a question in the chat from an anonymous attendee. Do you think you'll be able to draw any conclusions concerning the higher incidence of poor mental health in Black communities and the higher stop and search numbers?
Yeah, thank you for the question. So as I said, at the moment, what we've done is provisional. The challenge with exploring this is the mental health data itself, both in terms of both because it's sensitive. So some of the more kind of sensitive mental health data is less accessible. So the mental health data that we've used has been a validated measure of psychological distress, but it's a survey question. It's the data comes from a small sample of the population, and that creates a lot of challenges in terms of generalizing to the broader population, especially when we start looking at the smaller geographies, which we haven't done yet. So I think there are definitely challenges with doing it. I think the way that we've modeled it so far is certainly providing some indication of the direction that, well, not the direction in a statistical sense, but you know, the general relationship. I guess sitting here right now, I can't tell you definitively that that we could get some definitive conclusions about it, but I'm fairly confident in the approach that we're planning, for example, at looking at the level of local authority to explore this relationship. That then creates more data points, let's say, to look at this. So there's more variation that we can then look at trying to explain. So I think it's an approximation is possible. I think, as with anything in science, you don't ever prove anything. But I think there are definitely things that we can do to pick this apart a bit more, and then it's up for discussion, I suppose.
That's really interesting, reflecting how to open a conversation, even if, yeah, there can't be many conclusions drawn at the end. Thank you. We have a question from Tamrat in the chat, which is about the sort of real world impact and maybe policy impact of this. So Tamrat asks, would users be able to report stops and reasons? And also, would there be a way to prevent being stopped? For example, if a person of color with a nice vehicle gets stopped loads, is there a way you could record certain information to avoid them being stopped over and over again, or provide insights to police forces so that they do their work more diligently?
Yeah, that's an interesting idea. As to the first part of the question, in terms of preventing stops, I think from our standpoint, it's well, I was going to say, like, we don't have any you know, direct control over the kind of the recording procedures of that the police take, although one ambition is to certainly start opening up a conversation about with police on how these insights can sort of go both ways. The data definitely contain things like reasons for stops, and also outcomes for stops, and we also have quite detailed information on where stops happen. So one thing that we are interested in doing in future iterations is to, which you might imagine appearing on this area page, is to have kind of hotspots or a heat map of where stops are happening. So there's not so much about preventing stops, but it starts giving an idea of where stops are more frequent for different groups of people, and that can go some way to helping, yeah, people I guess understand where a stop is more likely. It's not exactly preventing stops, but it's adding more information to the picture. To that second part of your question, we you know, and this is something that's come up in the past as well, about sort of engaging directly with police to on this project. Our focus so far has been sort of creating the thing, so creating this hub, creating the tool, And we would like to, once we have this in a state where people are using it and it's clear, its final form is a bit clearer, we would be very interested in seeing how the kind of what we hope is an increased public kind of engagement with the policy of stop and search, how we can then use that with police to start having more meaningful conversations. As I say, I kind of alluded to this kind of one-way conversation that can happen. That's not to say that there's not a lot of people doing great work in addressing sort of these issues to do with stop and search, because there certainly are, and we've met with many of them. But I guess what I'm saying is that to have a more centralized hub of information that people can go to and discuss, we think can really sort of start opening up opportunities where we can have more empowered and meaningful conversations with police.
Fantastic, thank you. And if we have no more questions, then it might be a good thing to end on. How can people, if they have further questions for you later down the line, get in touch and keep connecting with the team? And is there anything else you'd like to ask of the audience here today?
So on the slides, which I guess this session is recorded, so you should be able to sort of get access to that. You've got my email address. I can also pop that in the chat actually in a moment. So we're very sort of keen to sort of talk to anybody and everybody. So please do get in contact if you want to. There's also links to the repos, the sort of the GitHub repositories of the work that's happening. So you sort of have that, and that's constantly being updated by Graham, Lucas, and Gareth. So that's one way of sort of keeping track of the progress with it. Yeah, I mean, I guess as an ask, the only thing would be, but if you are able to take a look at the dashboard and sort of let us know your thoughts, be as critical as you can be. Obviously, we're not looking for compliments, we're looking for ways of making this better. So please do have a look, and if you can provide feedback, we'd be really, really grateful. And yeah, otherwise, as I say, just definitely get in contact if you want to continue the conversation.
Fantastic. Thank you, Joey, and thank you for the rest of the team who've been here doing the work and also answering questions. Really fantastic to hear from you. And please do post some of those links in the chat. And as to that recording, that will be made available to everybody after the session ends. So before we go to our next presentation, we're going to have a quick 5-minute break. So we will reconvene at 12:39. So please go away, refresh your drinks, have a leg stretch, and come back at 12:39, 12:40ish, and we'll get started with our second presentation of the day. Thanks, everybody. Everybody, we'll give everyone a minute just to drift back in before getting started with our next presentation. Fantastic. So we've hit 12:40. Let's get started. So our next presentation is from Jeremy on school environments and policies and drivers of school connectedness. So over to you, Jeremy.
That's great. Thank you. Put my screen. Okay, let's just check that everybody can see that. Okay. Okay, thank you very much for the opportunity to speak today. I'm presenting on behalf of quite a large multidisciplinary team, and the project is co-led with Dr. Nicholas Page and Dr. Hayley Reid here at Cardiff University. On the title of the project, Understanding the Role of Secondary School Environments and Policies as Drivers of School Connectedness to Prevent Anxiety and Depression. I'll start then by giving you a bit of a background and the sort of overall aims of the project. And I guess in a nutshell, our vision is to harness data from the School Health Research Network in Wales to build mentally healthy schools. Just a little bit about the School Health Research Network. It comprises an infrastructure and partnership between researchers, schools, and other stakeholders. And every 2 years, it conducts a health and wellbeing survey in schools and collects data from students on a range of outcomes, including a number of mental and health outcomes. That survey takes place in probably just over 90% of secondary schools in Wales, now expanding to primary, and typically around 125,000 students take part. So it's quite a powerful data set. That's the data that we've been working with. And in the discovery phase, our project was exploring aspects of school connectedness and how they might function as protective factors against anxiety and depression. And within that work, the school environment was identified as a key focus for building school connectedness. And then in the current prototype phase, what we're doing is developing a school-level digital dashboard, which will empower schools to use their own data, so the data that applies to their own students in anonymized and aggregated form, to use their own data to identify priorities for promoting the mental health of their students. And also we want to enable other researchers to replicate our approach and apply the learning from our work. We're using a user-centered approach. So what we're effectively doing is working through a series of cycles of involvement and really trying to design the dashboard with the key groups that are going to use it so that we ensure that we meet their needs, both in terms of the function and the structure of the dashboard. And I've summarized here kind of 3 of these cycles, each of which kind of ends with the output of a different generation of the dashboard. So on the left there, generation 1, we've had inputs from staff and pupils and consulted with some young people's advisory groups. We've shown them some existing dashboards and to critique and consider functionality and usability of the one that we're developing for the School Health Research Network and schools. And from that, we have some mock-ups of the dashboard, which I'll be going on to show you in a minute. Where we are at the moment is really in the middle of the project in generation 2. And what we've been doing in recent weeks is engaging with schools across Wales and through some of the network events that the School Health Research Network has, and actually seeking feedback on the mock-ups from school staff and from other key stakeholders in those meetings to generate further ideas around content and layout. And pretty shortly, we'll have our first online coded prototype of the dashboard. And then finally, in generation 3 on the right-hand side, we'll be taking that online version of the prototype, which has got kind of dummy data coded into it, and back out to schools, but also to healthy schools coordinators who are key practitioners that support schools in each local authority in Wales to develop their policies and practices around health and wellbeing, linking in with the policymakers who are developing the whole school approach to mental health and its implementation in Wales, but also importantly working with young people. We'll be holding some workshops with those groups, collecting further feedback and then creating a refined version of the coded prototype. So that's a bit about the process, and what I'd like to do now is to show you the mock-ups that we have, and these are the slides that we've been sharing with school teachers, and in fact our latest event was yesterday, so it's all quite fresh in my mind, which is really nice. So for schools, what they'll do is they will each have a unique username and password, and they will log in to the website, which we anticipate will be probably cited within the School Health Research Network's wider website. So schools can see their own data, it's aggregated, it's anonymized, they can't see any other school's data, so it's only their data and only they can see that school level data. And then what we've been working on is looking at, well, how do we structure this dashboard? And essentially there will be, for now at least, 3 main areas of the dashboard: My School, Paid Studies and Evidence. And I'll take you through each of those. But My School is, as the name suggests, the school's data, so where we can summarize the students' the outcomes for different aspects of student health and wellbeing. Case studies, where we have a zone where schools themselves can share how they've addressed aspects of developing health and wellbeing, how they've used their data. And then thirdly here, linked to sources of evidence that schools can draw on as they develop their policies and practices. And just to say that, for instance, a lot of the feedback from schools has really highlighted the importance of the case studies. So that's what schools will see. And on this landing page, there'll be some information about the dashboard and also an embedded video that gives schools some input and ideas around how to actually negotiate the dashboard and how to interpret the data. Further down the page, we give schools information on the number of students that responded across each of their years in the survey, and also some information here around how to actually interpret the charts, which, as you'll see in a moment, are the kind of the core of the dashboard. And this is where we kind of get really, I guess, into the what for me, I suppose, is the most exciting bit, where we actually on this page then summarize the school's data. So they will schools will be able to choose from tabs that relate to the kind of broad topic areas. So, for instance, one on mental health and wellbeing, and then you'll see on the left here that what they can then do is, from a drop-down box, they can choose the topic or theme that they want to focus on. Most of the questions will be presented, as you'll see on the right-hand side here. So this is just an example for an imaginary school, the Shepherd Academy, which shows the number of students that usually go to bed at 11:30 or later when they have a school the next day. We show the data for each year group, and we also break down for each year group by male, female, and total. On the right-hand side here is the school average. And then the lines that you see running along the top here are the national averages for females and males, so the schools can get a sense of where their school sits in comparison to the national averages. And one of the things that we're exploring with schools is the kind of text that we provide to help interpret the data, and how much of that needs to be provided. So whether we include the tables with the data that the charts summarize. And then on the left here, there are also drop-down boxes that will do several things, one of which is where schools can actually focus in on 1 year. They can look at gender, either gender, so they can sort of subtract and add to how much they see here on this graph here. So that's the kind of that's one way that we display the data. The second thing that we do is we provide a graph here that shows schools how their averages change or kind of how they compare across different survey years, because this survey is repeated every 2 years. So here again, students who usually go to bed at 11:30 p.m. and we provide the total for whole number of respondents for boys and for girls across different survey sweeps. And then I mentioned that we also have these drop-down boxes here. And the other thing that this allows schools to do is to begin to kind of undertake cross tabulations. So to begin to see what might be some of the relationships between different topics and different questions in the data. So, and here again, this is around students that usually go to bed at 11:30 or later. And we show here the data for students that report that they've not been bullied at school, and for students that have been bullied at school. And again, this is not real data, but it shows you that you can look at how this aspect of sleep might be different across different groups within the school, or how different aspects of mental health, for instance, might be related to aspects of school connectedness. And there's lots of ways that the data can be looked at. And then, as I mentioned, some of the input from schools has been the importance of case studies. So what we'll have in this page here is actually examples of how schools have addressed particular kinds of issues that are summarised with the data, but also how they've actually used their own data from the survey to achieve that. And just as an example, this is one that was shared by a school, which was looking at aspects of bullying. And actually, and this is just one slide from the PowerPoint, it gives you a feel for the kind of data here, where schools are actually saying what they've done with the data, the kind of actions that they put in place, and then how they followed those up. And then the third tab will be around evidence that schools will be able to link to and to use. And there are four main categories here. First of all, in Wales, our National Public Health Agency, Public Health Wales, provides evidence summaries. And those are really helpful, or we think they'll be helpful for schools to look at how they use their shown data, their data from the survey, and how they might develop policies and practices. There's information also from Public Health Wales on the regional local authority level data from the School Health Research Network survey, so schools can look at the broader picture regionally and nationally. And a key thing about the dashboard is it's designed to be something that schools will use and can form part of the conversations and their interaction with practitioners that will be working with them. So the Healthy Schools scheme in Wales, we have we'll provide links to that. So that will support schools in actually kind of linking with their Healthy Schools scheme coordinators, and the dashboard becoming part of the work that schools and their Healthy Schools coordinators do together. And then finally, and we're sort of currently working on this, looking at what other sources of evidence that schools and others think might be important. And here's just an example of one source of evidence that we think we'll link to, which is the toolkit that Public Health Wales have produced on a whole school approach to emotional and mental wellbeing. And the idea is that the dashboard gives schools an overview of their data, but it also helps them to think about and to find support with how to actually put into practice and strategies for working on those areas. These are the benefits that we envisage for schools and that we've really been trying to understand if we've got this right, and we think we hopefully have. The dashboard allows schools to understand their data, make comparisons by gender, year group, and to look at between school and national pictures, but also to look at relationships between variables, for instance, between sleep and mood. Data is really going to be designed, and the dashboard is designed to help schools to identify priorities for action to promote mental health, to help them look at tracking change over time, because they get data every 2 years, and also as a way to help them to share their progress with key stakeholders. And then finally, we think there's a really important role for the dashboard in promoting citizen science. So helping to support schools in the ways that they currently and might in the future involve their own students in using this data to inform priorities, and also some really exciting opportunities for students to use suitably aggregated data within their own research. And for instance, the Welsh Baccalaureate, which includes students doing their own research. The benefits for other researchers, the first of these is about replication and open science. So there are a number of other school health research networks across the UK, and we form part of the HBSC, or Health Behaviour in School-Aged Children International Network, an international survey that collects a very similar data and identical data in many cases to ours. And we want to look at how we can provide learning and opportunities for those groups to replicate and use parts of the dashboard in mental health researchers more generally who are looking to share findings with stakeholders. Secondly, we want to really evaluate the implementation of the dashboard as we go forward and potential impacts, and to be able to share that with other researchers, and to think about how we've developed methodological innovation. So for instance, some of the measures that we use are Wellcome preferred measures, and how are we using those, and what might be some of the opportunities for further development there. And then thirdly, we think there's an important opportunity here around building research capacity, about sharing the methods and the learning for developing this dashboard, and for instance, how researchers can work with schools to develop citizen science when they're working with these kinds of data sets. I'm going to finish with just some key learnings from the project so far. First of all, to say that we're pretty much on track. The cycles of user involvement that I talked about at the beginning are mapped out. In terms of challenges, one of the things for us is just trying to align the dashboard development with school terms and school holidays, and I think we've been able to do that. Some of the really great learning for us as a team has been around user involvement and really looking at how we've benefited from that, and many of the things that we've gained from talking directly with young people and teachers, but also working as a multidisciplinary team, bringing together experts in data science, mental health, and computer science or database development has been really enriching for us. And in terms of exciting moments, I think probably for me personally, meeting with schools from across Wales has been one of the key ones. And I'll just finish with a photograph from one of the events at which we presented the mock-up that I've just shown you. And it really, I guess, brought alive the whole project in terms of actually being able to get some really immediate, honest and really open feedback from teachers and from other educational practitioners about what they thought about the function and the structure of the dashboard. So finally, thank you for your attention. My email address is on the screen there, and once we have our coded prototype, we'll be very happy to if people are interested in looking at that, in looking how we can do that, and very interested in questions and comments that you may have. Thank you.
Fantastic. Thank you so much, Jeremy, for a really interesting presentation and taking us through where your tool is at the moment, especially some of those insights from working with users, which I think we can get onto maybe in a bit. Please get your questions in, submit them from both the audience and the rest of the panel. But maybe a good one to kick off is the same I asked to Jolyon, which is looking forward 5 years, what are your hopes for this tool, its use and its impact?
Shall I start with the impact? I guess our vision is that this dashboard becomes, I guess, embedded within the school system, and it helps schools to improve the health and well-being of their students. So in terms of an ultimate outcome, I guess it is for us that actually the data and the way that it's being presented is helping to address some of the really important health and well-being needs of students. And I guess a key thing for us is to understand how this dashboard fits within that kind of system. So thinking about how can we make it so that it meets the needs of schools, best ways of kind of presenting the information, and then also looking then at how schools are actually going to use it and who are the other people that can support them with that. So I mentioned the Healthy Schools coordinators, for instance. They're really key practitioners that help guide schools, provide them with advice around developing their action plans. So how can the dashboard fit within that? So in 5 years' time, I guess what we'd really like to see is that this dashboard has become embedded and integrated within, I guess, usual practice, and that it's helping, I guess, to address kind of those broader goals that schools have around kind of using data, interpreting it, and then reviewing their progress. And I guess then there's another thing really is around application. So we're really excited at looking at, in whatever shape or form, how can kind of looking at the potential for using this in other school health research networks and surveys, how can we capitalize on that?
Fantastic, thank you, really interesting. And I think something that occurs to me listening to the two of these presentations today is there similarities in terms of the number and variety of different people you're envisaging using your tool. And there's an element of citizen science and citizen research as well as being for the academic researchers. And as part of that, I know you talked about your sort of extensive work with users and how that's been really important. And I wondered if you could tell us, is there anything specifically through that process of talking to teachers and young people that surprised you or that sort of prompted a change in direction when you're developing a tool? Or was it mostly all things you sort of had a hunch about already?
I guess our sense is, I think, from working with schools that we kind of we were kind of starting in the right area. So I think one sort of learning for us is that we did try and start by thinking about, well, what are they doing with their research data and what might they do? And we've tried to build the dashboard and its sort of functions around that. I think, but nevertheless, they have really kind of helped us to think about what exactly are they trying to do with the data, and I think that's been a really important point for us. So not just about how do you view it, but then actually, for instance, at the meeting yesterday, how do you download parts of it? How do you kind of share it with other stakeholders that you're trying to kind of work with? So really trying to understand, I suppose, not just how you navigate it, but actually what do schools need to make sense of it and actually to kind of use it to inform their everyday practice. In terms of surprises, one of the things that I just personally I wasn't maybe expecting is that we've worked with a couple of young people's advisory groups, and when we talked about whether they would, what might be their kind of interest in the data, and they kind of really seemed quite excited by the idea of being able to use, as I say, aggregated sort of data to inform kind of lessons and kind of some of the projects that they do as students. So I think that that's really brought home to us the importance of kind of capacity building and skills development, about how might students access this, how would schools do that. But it was one of those kind of light bulb moments that you just sort of saw people getting quite excited about the idea of being able to work with real research data within, say, their Welsh Baccalaureate, where they have to do their own piece of research and they have to do analysis. So why not bring these aspects of it together in a way that would support that?
Fantastic, yeah, a win-win situation. Brilliant. We have a question in the chat from an anonymous attendee saying, how are you planning to link relevant resources that you mentioned in the slide titled PHW evidence summaries?
Let me see if I think I understand the question. There will be a kind of, as I sort of said, there's like there'll be a page or a zone that will be highlighting key sources of evidence. So there are a number of ways that we could do that. We've been trying to think about sustainability, that if we try and make it too complex and we try and put too much on the actual dashboard, it could become harder to navigate, and B, it could create a lot of work, and we want it to be something that can be maintained over the longer term. So our thinking is that probably it would be a kind of a hyperlink direct to page within the public health website with the particular resource that's being highlighted. And then we're looking at the kind of the best ways of organizing that, whether you put probably now all of the evidence will be in one sort of page, but might be kind of grouped. The other thing is it's about, I suppose, again, the healthy schools practitioners, whether they would be able to help schools to navigate that. And then finally, the other thing is we're interested in exploring with schools further what kind of training or what kind of skills development would they need. So how can we highlight, perhaps in that video, where to, to highlight where to get hold of those resources. So I think that's how we're going to be doing it, is having that evidence page, but then also looking at, well, what helps schools to reach it, and asking them for their advice on if what I've already described to you is the best way of doing it.
Brilliant. Thank you. Really, really comprehensive. And we've got a comment in the chat from Graham, just noting that as a governor, it could be a really powerful and useful tool for schools, which is a great vote of confidence. And on that note, I wonder if there are people with any questions for you or want to get further involved in this tool and how it's rolled out. What should they do? Who should they come to? Who should they contact, Jeremy?
They can contact myself in the first instance, and my email address is on the slide, so I'm really happy to be contacted there. And then we'd be very happy to kind of to share further information, to answer questions, and however specific or broad that would be. So we would really welcome any and all questions, and also kind of feedback, critical, positive. It'd be really useful to get people's thoughts on anything around the slides and the mock-ups that we could improve or that people think is particularly useful. Just in terms of the primary schools and the network that I've talked about at the moment, I talk specifically about the secondary school network, but there's now a primary school network, and you can see how what we've done here could be kind of replicated across primary schools maybe in the future.
Really exciting. Thank you, Jeremy. And with that, we will head to our wrap up, I think, as we're about at time. Just to say a huge thank you, first of all, to our two presenters, Jolyon and Jeremy. Thank you very much for taking the time to take us through your tools, put together a presentation, share with your insights, even at a fairly early stage. It's really really beneficial and really insightful. And thank you again to everyone who's joined in our audience today as well, and for asking questions. It's been great to have a discussion that gets into the in-depth detail of these tools, and I hope that you will stay involved and stay interested in their progression as we move forward through the next couple of phases of the Data Prize. I'm going to quickly share my screen for one last slide, which is a thank you slide. And we will be grateful for feedback from anyone who's attended today. What worked well, what didn't. We have a link which Juliet will drop in the chat, but we also have this QR code which you can scan. It's 3 questions, should take about a minute. We'd love all of your feedback so that if we do any future show and tells in the future, we can keep improving these and make them the most positive experience possible. And I think that's pretty much it. We will also drop our email addresses quickly in the chat for our own email, which is the Data Prize email address to Social Finance. If you have any general questions about the prize, how it works, anything that's specific to maybe all teams rather than a particular one, and for anything else, please do use the contact details provided by our panelists. So I'll stop sharing and just say again, thanks to everybody for joining. I hope you have a good rest of your day, and speak soon. Thanks very much.
Thanks very much.